That's okay. It's on. Good morning, everyone, and welcome. I'm Kevin Mortimer from the Liverpool School of Tropical Medicine and the Union, and it's my pleasure to invite you to this plenary on deadly air. When you put together the household air pollution, ambient air pollution, occupational-related air pollution, tobacco-related air pollution, we're dealing with a problem that kills some 15 million of us every year. In this session, we're going to hear about how the tobacco industry is trying to get us to breathe more and more polluted air, about the problems of household air pollution, ambient air pollution, and chronic respiratory diseases. And we're going to hear a civil society and patient perspective about how the harms of breathing deadly air can be felt by patients. Before we start the plenary, though, there's an important moment, which is the award of one of the union's prizes. And for this, I'd like to invite up to the stage Paula Fujiwara, the union scientific director, to award the prize. Paula.
Thank you, Kevin. I'm a victim of the deadly air here in India, as you can tell from my voice. I'm going to present the Union Scientific Prize. And this prize acknowledges researchers at any stage in their career for tuberculosis or lung health published in the last 5 years. And this year's award goes to Dr. Katarina Kranzer, who is an epidemiologist and a clinical microbiologist. She is currently clinical associate professor in the infectious disease epidemiology at the London School of Hygiene and Tropical Medicine and the Biomedical Research and Training Institute in Harare, Zimbabwe. She is also honorary clinical consultant in microbiology at University College London Hospital. Her research to date covers epidemiologic field studies, clinical cohorts and trials, operational research, impact evaluations, and diagnostic accuracy studies. Her exemplary work has been characterized by the appropriate use of research methods across different disciplines with an emphasis on collaboration and capacity building. She has published more than 120 peer-reviewed publications, and as a member of the Union's Coordinating Committee of Scientific Activities, she has also contributed to the scientific content and strategy of the Union's World Conference, including this year. So it gives me great pleasure to invite Dr. Katarina Kranzer to the stage to accept the Union's Scientific Prize.
Thank you very much. I'm very honored to receive this prize, and I'm very happy to be a member and to be part of the scientific committee. Thank you very much.
So you'll all have seen the tobacco pledge slide that was up there. So this is firstly a plug for that. And then to move to introduce Paula Johns, who's our first speaker today. So Paula is on the board of directors for the NCD Alliance. She's a sociologist who's done research on development, gender, ethnicity, public health. She's co-founder and director of ACT Health Promotion, a Brazilian coalition of more than 1,000 organizations to prevent NCDs and promote healthy lifestyles, including the topic of tobacco control. We look forward to hearing what she has to tell us about tobacco industry interference. Paula, you're very welcome.
Well, good morning, everyone. Thank you for the organizers for the invitation. It's a pleasure to be here. I'm a bit jet lagged, but that happens when you come from Brazil to India. Let me Yeah, it works. I'll briefly introduce, thank you, Kevin, for the introduction. I'll briefly introduce, well, that's my disclosure of interest from the organization I work for. I'll briefly introduce the organization I work for to give a bit of context. We were founded as an Alliance for the Control of Tobacco Use, and we've really done a lot of coalition building, communication and advocacy to promote the implementation of the FCDC in Brazil, and also participate in lots of regional and global initiatives through the Framework Convention Alliance. And then in 2013, we expand the scope of work to work around the other risk factors for non-communicable diseases, such as alcohol, healthy food, and physical activity. By the way, we're talking alcohol is a really neglected area of public health when it comes to the regulation of the risk factors. And then we became ACT Health Promotion to better encompass the other risk factors. So we work pretty much in coalition building, and that's just a picture of like we have annual meetings in Brazil, and we do a lot of advocacy to implement policies that will change the environment. So it's pretty much like, well, we believe that the work that we do is that a healthier environment, it's incredible, it's very, very important to promote healthy choices. We cannot give the responsibility to the individual to have a healthy lifestyle if the environment is completely contrary to that. And I think deadly air, it's an incredibly important aspect of it, that how can you guarantee that people are healthy if not even the quality of the air it's proper. So, and we also do training and advocacy for our coalition members. How many people in this room are familiar with the Framework Convention on Tobacco Control? Can you give me some hands up? Okay, that's not even a half. So very briefly, it's the first global health treaty. It was negotiated in the World Health Organization. And very briefly, I think that's a very summary of the treaty, what it means for advocacy and for the work we do. I think I have this picture there because I think the FCDC is pretty much considered as the holy grail for public health issues, as a very good solution that was very effective in moving policies around tobacco control. So the main message is there, it's like simple population-wide policy interventions work. And we are here talking about, there are 4 major policy areas, among others, but some of the most important ones in terms of creating this healthier environment. I would say it's the advertising bans, smoke-free environments, warning labels, and taxation. And the idea, the fact that we were negotiating a treaty during 3 years also helped to create lots of coalitions around the world and to build momentum and to help countries to implement really effective measures that they were not doing before that. So it was a very important process to build this momentum that we have. And also, I think one very important aspect, which is the introduction to the theme of my talk today, is that there was a recognition of the industry interference as the major obstacle for the implementation of policies. So the Framework Convention on Tobacco Control has one specific article, that it's the famous Article 5.3 for the people who are from the area, which talks about like the industry needs to be left out of the policy making table or else it will never work. And that's not because people who were in this room, delegates that were in this room just started from the onset thinking, oh, we don't like the tobacco industry. It was the outcome of a process in which there was a recognition that all the industry moves were to make the treaty as weak as possible, to make it ineffective, not to pass the effective policy. So it was just like they had really lots of strategies throughout the FCDC negotiations, and they still do it today. But it has always been the sense that what can you do to delay the most effective policies for public health? So there is also recognition from the World Health Organization, there is a conflict of interest that you cannot really deal with because the mandate of the tobacco industry is simply completely different than the mandate of public health. So Talking about the industry, what's the main goals? One of them, it's profits, and I think that's an important image to show how much of the profits of the tobacco industry still comes from combustible tobacco. That's 95%, and it's a really huge amount. And now there is the market of the, what do you call it, potentially reduced risk products. I'll put a P in front of the RRP. So it's like that's still a major source of income for the tobacco industry. That's just the example from Philip Morris. There are other global ones like BAT and Japan Tobacco. And then there is a really strong body of evidence showing what types of tactics the tobacco industry uses to delay. I mean, the goals, besides profit making, which is because they need to they have their shareholders, so they just need to make profits for their shareholders. So, and that's to block, weaken, or delay legislations, and also create a lot of controversy, and I think we are in the middle of that right now when we think about the new tobacco products. And also, of course, to get a seat at the decision-making table. So that's just, I'm not going to go through it, but just a list of the tactics that have been extensively documented, and there's lots of information about all of them. Going to what are the latest forms of tobacco industry interference, not that they are not doing the earlier ones still, they're still acting on that, and their behavior also very different from place to place. Where you have stronger regulations, you act in a certain way. Where you don't have regulations yet, you act in a different way. So although we are talking here about global corporations, it depends where they are operating that they will have a different behavior. So the good old ones, the tactics, they're still in place. For example, saying that increase in taxes do not work, and that will increase in contraband. Using farmers who grow tobacco as front groups, that's a very big reality in Brazil. Every single tobacco control policy, you have like the tobacco farmers funded groups saying that it will impact them, and most of it's lies. It really don't stand in real life. And now there is this thing about being a stakeholder around the Sustainable Development Goals. So I think within this global agenda, they are really getting some entry points into being part of the discussions. And of course, the discussions around harm reduction, which is a very controversial issue, and I think it's part of this thing of promoting controversy. And one of the characteristics of the tobacco control community, that there was a very clear sense of unity and what needs to be done collectively for tobacco control. And the first major area of tobacco control was the smoke-free policies, that the entire community worked through 4 smoke-free policies all over the world, and that was very important to build this sense of community. The thing with the harm reduction products, it's one of the things that are creating a lot of divide among the tobacco control community, and I think that's also part of a broader strategy. Well, the official discourse of the tobacco industry, it's that the new products are, just look at if you think about the part that I've highlighted, that they say that there had been recent discussions about a merge between Philip Morris, which Ultra, which is Juul's, but it didn't move forward because there were so much like scandals going around Juul in the US right now that the conversations about this merge have stopped for the time being. But if you think about that sentence, our focus is and will remain entirely on helping adult smokers switch away from combustible cigarettes, the leading cause of preventable death in the world. That's what they say. But the fact is that 1 in 4 high school students are using e-cigarettes in the US. And you can see there in the graph, I think it's really worrying that what happened in terms of youth initiation in becoming addicted to nicotine, which is the major addiction around tobacco. And these are just some images of some of the advertising campaigns. And if you look at the images, if you can say that it's for adults, it really doesn't look like that. In addition to these major campaigns like this is in Times Square. You have a lot of like some of the other products too that we are calling it the new light cigarettes, because there have been these things that when they were first, this image here, it's an old image when the first studies start relating tobacco smoking with lung cancer. And these are the recent ones, so they are exactly the same. It's just the new version of the light. So now we have found a new and healthier product, but none of these products are healthy. So it's another image here, how similar the old advertisement for the light cigarettes is to the advertising for the electronic cigarettes nowadays. Another area is the Sustainable Development Goals, which they are kind of promoting themselves as like a very important part of that. And the discourse again talks a lot about the relative risks of our products that they want to change, and then they make all the things that they are going to do. I mean, here I have an image from BAT and one from Philip Morris, but all the things that they are doing in order to achieve the SDGs. And they claim that they are transforming themselves, that they are transforming tobacco, that they want to be more than a cigarette, far more than a cigarette company. Philip Morris has been much more aggressive in that area. And there is this Philip Morris Foundation, which is called a Smoke-Free Foundation, with really heavily funded exclusively by Philip Morris by $1 billion. It's a lot of money put into it. But let's just look at the case of Philip Morris. They claim that they want a smoke-free future, but why are they still marketing? As I said before, their behavior changes from place to place. So in places where you are still allowed to advertise conventional cigarettes, you still do that. So that's just an example from Israel. That's an advertising in point of sale. So the package, it's really appealing. And that's one from Indonesia. And that's a billboard in the middle of the street. And that's something that they don't do in other countries that have stricter regulations. So it really changes depending on the jurisdiction. It's not they are conscious and they do what they're not supposed to do anymore. They don't do it because there are regulations that prevent them from doing it. It's not because that they become the good guys. Social media, that's an example of like, these of conventional cigarettes. You see they are teenagers, so the marketing is still happening very heavily, targeting youth. You see the cigarette pack there. And that's and there are so many images, and there's so much going on in social media targeting youth groups. And that other one, this is from IQOS, this Philip Morris heated tobacco. And I mean, there's the added complexity that you have the heated tobacco, you have e-cigarettes, you have many different products. So that adds more complexity to the issue. And there are some examples here from around the world. This is from Turkey, that the IQOS advertising again, and then you tag friends and all these strategies for engaging youth. The shops, and this is community activation campaigns in New Zealand, and that they are really promoting it and selling even it cheaper to Maori communities so that they can have access to a less harmful product than cigarettes. Party sponsorships, that's some imaging is in Italy with the very popular singer from Italy. And I mean, if you see the pictures again, I mean, they're so similar to the old cigarette advertising, right? That's in Russia, and normally, I mean, I don't see that very much, pretty much as advertising for older people, for older smoker. That's in Colombia, and you even have like Christmas fairs, and you have these really pleasant places and beautiful, and the shops are really, I've been to some in Brazil. We don't have shops because it's not commercialized there, but I've seen some shops in Cape Town. I was just like, wow, they are so cool. I mean, they look like iPhones. So some images of some shops from different places. So they are claiming that they are trying to give up cigarettes. I don't think we have much reasons to believe that so far. And they are doing a very, very heavy campaigns, particularly in places where it's not allowed to sell, which is the case in Brazil, for example. So there are some images there. And in Brazil, the reason it's not sold officially, I mean, it's not really prohibited, but when they tried to introduce e-cigarettes in Brazil, the Brazilian regulatory agency said, oh, if we're going to introduce it as a product to help smokers to quit, you have to prove that it works that way. And they, of course, they could not prove that, so that's the reason. So it's pending until they can prove that it's helpful for smokers to quit. So that's the stage in Brazil. But now with IQOS, they are really doing very, very heavy lobby and campaigning heavily with the population, saying that, wow, when you prohibit something, you deny the people the right to talk about the alternatives. So they have, like, we need to talk about that campaign, that Brazilian smokers look for alternatives to the conventional cigarettes, but they face prohibitions. So, and they, I mean, there's advertising in taxis, and it's all over the place right now. I think this is some challenge that we have. It's like, I think this is I love this publication because it's not only about tobacco, but it's also about policies and practices and products. It's not only, because the issue of like these non-communicable diseases and its risk factors is not only the product, it's also about the policies and the practices of the corporations behind it. And that's a very interesting publication that shows the tobacco industry tactics and how it also applies for the other ones, like big soda and big alcohol, that they're using the same ones. And I think this also applies for the new products from the tobacco companies. The fool me twice message, so, which is one of the reasons I picked that one. I mean, do we want to believe it again? Haven't we seen that movie before? So to finalize here some food for thought, I think I love this image as well, that we are part of the solution. There is a stranger there, I mean, well-dressed, but I'm not sure whether this is going to work. And a few final message. I think dual use is a major problem. I mean, let's assume that there is a potentially less risky product, less harmful product in the market. How are we going to deal with dual use? Could we immediately switch all smokers to alternatives? How much do we know about these alternatives? It took us so many decades to figure out the harms of tobacco. Are we going to repeat the same story again? So what do we do about the population-wide effects of those new products? What do we do about youth initiations that we have seen that in places where it's legal, youth initiation, it's been a real huge problem in terms of like getting young people addicted to nicotine again. But at the end of the day, I think business as usual, it's not working for public health. The market rules are not working because we still allow for corporations to profit and not to pay for the externalities of the products that they put out in the market. If the final price of a product could take care of the costs it has for society, maybe it could be different, but it's not like that. So if they really want to change, I think they should be changing the rules of the market that do allow for profit in the way that they profit nowadays. Because as we saw in one of the first slides, most of their profit is still from conventional cigarettes, 95%. So they should be really doing something around that. And I close here with hello from Brazil. Thank you, everyone.
Thank you very much, Paula. So certainly food for thought and I think further motivation to sign the tobacco pledge. So now turning to Sandeep Salvi, who's giving our second talk. So Sandeep is director of the Chest Research Foundation in Pune, India, which is a state-of-the-art research institute with a particular focus on obstructive lung diseases. Sandeep's an honorary senior clinical lecturer at the Imperial College London, visiting faculty at the Johns Hopkins University, and is on the board of directors of GOLD. He's a leading expert in the field with multiple research papers to his name. We're delighted to welcome you. Thank you, Sandeep.
Thank you very much. Wish you all a very good morning. At the outset, I would like to express my very sincere thanks to the Union for giving me this opportunity to share with you some of the knowledge that I have earned over the years about the impact of air that we breathe on our health. The first thing that we do when we are born is we take a breath, and this kickstarts life. This goes on until we breathe our last, and that is the end of life. So life in a sense is defined as the time interval between your first breath to the last breath. And life is almost equated to breath. Why do we breathe? Perhaps you may not be aware, but on a daily basis, each one of us inhales 10,000 liters of air. This air goes into the lungs, and from the lungs, the lungs extract 1,000 liters of oxygen that is necessary for our health. This 1,000 liters of oxygen is transported to different organs of the body through the red blood cells. And you may perhaps not be aware about this as well, that there are 25 trillion red blood cells circulating in the body at any given point of time. And this is out of the 37 trillion cells that the human body is made up of. So 65 to 70% of the body cells are only the red blood cells whose prime responsibility is to transport oxygen from the lungs to the different parts of the body. Every red blood cell has about 300 million hemoglobin molecules, which carries 4 molecules of oxygen with each of those hemoglobin molecules. In fact, if you look at the main nutrient that is transported in the blood, and if you look at the quantum of red blood cells that occupy the blood, it's about 45%. And this 45% is actually the oxygen that is being transported to the different parts of the body that nourishes the body. Look at the amount of investment that the human body has made in order to extract the oxygen that is present in the air and to transport it to different organs of the body. And why so? It is because oxygen generates 90% of the energy that the human body produces every day. Only 10% of the energy comes from the food that we eat or the water that we drink. But because we have to pay money or we have value for the food that we eat and the water that we drink, we have value for it. But because air is free for us, we don't seem to have any value for this nutrient that is responsible for producing 90% of the body's energy. Let me remind you of what is pure air. Pure air is a combination of nitrogen, oxygen, argon, a little bit of carbon dioxide, and water vapor in very fixed concentrations. And out of this, it is only the oxygen that is necessary for the human body. But in the real world, hardly any one of us actually breathes pure air. And according to the WHO report, 90% of the people in the world live in areas where the levels of pollution are pretty high. Only a minority of us on this planet have the luxury of breathing pure air. The two main components of air pollutants that seem to affect the human health are the gaseous pollutants, and these include carbon monoxide, carbon dioxide, oxides of sulfur, oxides of nitrogen, and ozone. But perhaps more important than the gaseous pollutants are the particulate matter pollutants. These are extremely tiny particles that have the ability to enter into the deeper portions of the lung and not only cause damage to the lung, but also get absorbed through the circulation in the lung, enter into the systemic circulation, and then get deposited in other organs of the body where they cause damage. So the quality of air that you breathe is a prime determinant of your health. Air pollution is essentially classified into 3 different types: ambient air pollution, or AAP, household air pollution, or nowadays it's also called as indoor air pollution, because indoor air pollution could not necessarily be only from your house. It could be from the workplace or the school that you go to, or any other indoor air source. And then finally, the occupational exposures to different types of air pollutants. What are the different sources of ambient air pollution? And just to quickly take you through something that perhaps we all of us know about. Exhaust from motor vehicles is one of the major sources of ambient air pollution. Road dust that is formed because of the movement of vehicles is an important source of ambient air pollution. Industries, crop burning, and especially in this time of the year in Delhi, all the pollution is coming from a neighboring state because they're burning the stubble from the farms. Waste product or garbage burning is also an important source of ambient air pollution. And then burning of dried leaves, especially during the winter season, when this is going to start now. So these are all the sources of ambient air pollution to which we are exposed to. And until recently, we believed that this was the only source of pollution that had an impact on the human health. Until recently, we have realized the importance of household air pollution or indoor air pollution. 60% of the world continues to use biomass fuel for cooking. And for that, they use crop residues, animal dung, and wood in a kitchen that is usually not very well ventilated. So this is a very important source of household air pollution that affects about 60% of the world's population. And if you quantify that pollution exposure in terms of number of cigarettes that you smoke, it is about 25 cigarettes per day if you cook your food on a biomass fuel. Very recently, we have been able to show that burning of a mosquito coil, one mosquito coil during the night for a period of 6 to 7 hours. When you sleep, you keep the door and the window closed. You have almost smoked as many as 100 cigarettes. 50% or 60% of India's population, or about 50% of the world's population, continues to use something like this to get rid of mosquitoes. And this is also an important source of household air pollution. Burning of dhoop sticks, which many of us do in India, is perhaps 5 times more polluting than the mosquito coil. So this 4-centimeter dhoop stick, which is a sort of an incense stick, just burns for about 15 minutes. But during those 15 minutes, it produces as much amount of pollution, particulate matter pollution, that is equal to smoking around 500 cigarettes. And very recently, we measured the levels of air pollution, personal levels of exposure to air pollution during the burning of different types of firecrackers. And we actually measured the levels of personal PM 2.5 during the burning of each one of these. The snake tablet produces PM 2.5 levels of around 60,000 micrograms per cubic meter. And this is compared to the 50 micrograms per cubic meter, which is the WHO safety limit. And you can see the amount of pollution that is produced by the other firecrackers, which are extremely, extremely high. This has just been published a couple of months ago in a journal called Lung India. Air pollution kills about 6.5 million people every year. And it is one of the top leading causes of death in the world. India is the leading country in the world when it comes to number of deaths due to air pollution, followed by China, then Pakistan, Nigeria, Indonesia, Russia, and so on. So out of the top 10 countries, it's only the United States and perhaps Russia, which are more or less the little more developed countries, but it's the developing countries that seem to get largely affected because of the harmful effects of air pollution. In fact, air pollution kills 3 times more people than those due to HIV, AIDS, TB, malaria, all put together. That is how harmful air pollution is. The harmful effects of air pollution start even before you're born. And this was a study reported from the city of New York, where they took 10 randomly newborn babies in the city of New York. And after the babies were born, the umbilical cord was cut. They collected blood from the umbilical cord and sent it to the laboratory to look for presence of circulating air pollutants. And do you want to know what they found? They found presence of 287 different pollutants circulating in the umbilical cord blood. So whatever pollutants the mother inhales, It goes through her lungs, into the circulation, through the placenta, into the growing fetus. So the exposure to air pollution starts even before you're born. This was a study that was reported a couple of years ago from Tanzania, where they collected the placenta of these mothers who just delivered their babies. And they had two groups of mothers, ones who were exposed to biomass fuel and ones who were not exposed to biomass fuel. They measured the levels of PM 2.5 during the entire pregnancy period. And after the babies were born, they took the placenta and looked for presence of any abnormality in that. And what they found was thrombosis in a significant number of these placenta in women especially who were exposed to high levels of PM 2.5. And we all know that the placenta is the main part of the tissue that actually nurtures the growing fetus. And if you're going to have blockage of the blood circulation, that is perhaps one of the reasons why you have babies that are less underweight, or the reason for why do you have stillbirth in this population. So clearly air pollution has an impact on the placenta that has an impact on the age, the weight of the babies. It's not only the household or the biomass smoke that is responsible for this, but even diesel exposure has been shown to affect the placenta in some of these animal exposure models, and more recently even from London, they found presence of diesel exhaust particles in the placenta of women who just delivered their babies. Globally, pneumonia deaths in children under the age of 5 is a big problem. 120 million children under the age of 5 suffer from pneumonia every year, out of which 8 million undergo hospitalization, and about 1 million children die every year because of pneumonia. Why am I showing you these figures? Because 50% of these childhood pneumonia deaths are directly attributable to the household air pollution that these babies were exposed to. So this is an important and a leading cause of pneumonia and death in children under the age of 5. A very nice study from Japan that measured the levels of air pollution in these pregnant women, and then after the babies were born, they were followed over a period of 2 to 3 years. Then they segregated those women into two groups: those who lived within 50 meters from the main road, and those who lived more than 200 meters from the main road, just to find out that if you live close to the main road, does that have any impact on the children that are born to these women in terms of asthma and other allergic diseases? And this is exactly what they found. If you're born next to a road, the chances of you developing asthma as a child increases by about 4 times as compared to a child who is born in a family that has a house that is more than 200 meters from the main road. So clearly proximity to the main road with the motor vehicle pollution has an impact on the prevalence of asthma. Children are perhaps the most vulnerable of us to the harmful effects of air pollution because they have sensitive lungs, they're growing lungs, they breathe in more air as compared to the adults, and plus they're shorter in height, so the pollution levels are more at the lower levels than at the higher levels. And that is the reason why children are more vulnerable to the harmful effects of air pollution. And that has been shown to be directly associated with the risk of developing respiratory tract infections, asthma in children, as well as poor lung growth. The trajectories that you see here in this cartoon are of the lung growth from different parts of the world. So the green line represents the growth in your lung function up to the age of 20, and then there's a slow decline over a period of time. And this is the population that is relatively exposed to cleaner air. The red line represents people or children who are born in developing countries where they're exposed to high levels of air pollution. The lungs do not grow properly. And if you look at the color of the lungs in children who live in polluted areas, clearly more darker and as compared to the healthy lungs, which are supposed to be pink in color. Compared to 1 billion smokers in the world, as I said earlier, there are 3 billion people in the world who are exposed to biomass smoke. And this has now been identified as one of the main risk factors for COPD. In fact, in a country like India, 55% of the COPD is attributed to biomass smoke. COPD is the second leading cause of death in India, and globally, it is the third leading cause of death. I was fortunate enough to be a part of the Global Burden of Disease report, or the GBD report, where we looked at the risk factors associated with COPD in different parts of the world. What I'm showing you over here is the population attributable risk due to various risk factors for COPD. High SDI represents high socio-demographic index, which are the rich countries in the world, and the low socio-demographic index is low, are the poor countries of the world. So as you go from the rich to the poor countries, look at the contribution of tobacco smoking as a risk factor for COPD. It reduces from 72% to about 23% in the developing countries. So clearly, as the countries are poorer, become poorer and poorer, biomass smoke and ambient air pollution become the leading cause of COPD in this population. In fact, 65% of the global COPD is because of non-smoking risk factors. Tuberculosis is something that all of us know about. I was very inquisitive to know what are the risk factors that are associated with TB. And I've shown you a pie chart over here that depicts the different risk factors associated with TB. You can take your guess, but if you would have asked me earlier, the only risk factors that I knew of was HIV, AIDS, diabetes. These are important risk factors for TB, or even perhaps poverty. But let me show you some very interesting observations that were reported a few years ago. Malnutrition accounts for 34% of the risk for developing TB. Indoor air pollution is 26.2%. Smoking is 22.7%. Alcohol is 13%. HIV infection is 7.3%, and diabetes 6.3%. Now, this was something that was new for me as well. Indoor air pollution as a major risk factor for tuberculosis, and especially in a country like ours, something that doctors are not aware about. Household air pollution has also been shown to be associated with the risk of developing lung cancers, and this is a very big study from China, a prospective study over a large period of time. And the risk of developing lung cancer, especially in women who cooked using biomass fuel with poor ventilation, was around twofold greater as compared to women who use cleaner cooking fuels. So air pollution is now a known risk factor for developing lung cancer as well. The cardiologists have realized the importance of air pollution, and more recently they've started coming up with review articles on how air pollution affects the heart. This was a very old study published in the New England Journal of Medicine a few years ago that stratified the risk factors associated with an acute heart attack, especially in the elderly, vulnerable population. And you can see that smoking, lack of physical activity, diabetes, anger, they're all known risk factors for developing a heart attack. Look at the last column. And you can see for yourself that just spending 1 hour in the traffic is a bigger risk factor for developing a heart attack than having high blood cholesterol levels. The risk of developing diabetes has also been shown to be high because of exposure to air pollution, and especially with PM 2.5, this is the small particles, the risk can increase by about 40%. Obesity is something that we have just recently started realizing as an important cause, as an important product because of exposure to air pollution. And this is an experimental study in China where they exposed these rats to air pollution, and the pups that were born to these mothers who were exposed to air pollution, they were heavier, they had high blood cholesterol levels, and they had all the features of what we would classically call as metabolic syndrome. So there is a lot of emerging literature as of now telling us that obesity is an important cause of air pollution. So you're fat not only because of what you eat, but also because of what you breathe. So we all know that air pollution affects almost every organ of the body. And it's important for us to start waking up and start realizing. Starting from my first slide, oxygen nourishes us with energy that produces 90% of the body's energy. And if you're going to breathe polluted air, it's going to have an impact on almost every single organ of the body. Thank you very much.
Thank you, Sandeep. So I'm persuaded the only safe and sensible thing to do is to stop breathing. Now to our last speaker today, Mr. Sankar. So Mr. Sankar established Empower India in 1991 with a team of development activists, healthcare professionals, and researchers committed to social justice. Empower India has a vision of empowered, gender-just communities leading sustainable and quality livelihoods. Mr. Sankar is going to give us a civil society and patient perspective. You're very welcome.
Very warm good morning to all. Namaste and Vanakkam. I am from Shankar from Tamil Nadu.
If we think we can fool nature, because nature always strikes back, and around the world, nature is striking back with fury.
People are dying. Entire ecosystems are collapsing. We are in the beginning of a mass extinction, and all you can talk about is money and fairy tales of eternal economic growth. How dare you!
We must continue to work to guarantee healthier lives for everyone by ensuring that people have access to, among others, affordable, preventive, curative, and rehabilitative health services.
Today, we're asking all countries to increase their investment in quality primary health care by at least 1% of GDP, either by increasing or relocating health spending or both.
This is about our organization. We are working with grassroots communities for the past 20 years. We are having an UN ECOSOC status, and we are accredited to UNEP and UNCCPD, and also we received the State Consumer Protection Award from Tamil Nadu government. And this is about me. And myself is suffering by asthma due to air pollution since 2000. Because due to this asthma, I have to carry always my inhaler. But at any point of time, I'll suffocate and I have to take this inhaler. So I am myself a victim of the air pollution. The air pollution and asthma is irreversible airflow obstruction caused by a combination of genetic and environmental factors. Environmental factors including exposure to air pollution and allergens. Other potential triggers include medications such as aspirin and beta blockers. Significant associations of chronic pollution exposure with asthma in children and adults. Chronic air pollution exposure, it leads to lung injury, inflammation, oxidative stress, and lung disease. According to World Economic Forum, in 23rd August 2019, poor air quality leads to depression and bipolar disorder, this study finds. And they are related to this WHO report. We are in the regional estimates is showing that 7 million deaths. 1 in every 10 asthma patients in the world is in India. This is a more shocking fact. 90% of the childhood asthma and 50% of adult asthma is caused due to environmental allergens. So this is, as far as India is concerned, it is very crucial for related to asthma. This is a air quality slide related to Delhi on 29/10. The very poor air quality is shown in this slide. And also I want to state that 28 to 28-year-old non-smoker Delhi woman diagnosed with stage 4 lung cancer due to air pollution. The worst part is the woman is a non-smoker. India ranks 177 out of 180 in Environmental Performance Index. Report on environment ranks India among bottom 5 of 180 countries, warns public health crisis. This is a slide related to that. This also, here goes the entire list of 20 most polluted cities of the world. It is in most of the cities in India. India has 14 out of 15 most polluted cities in the world. This is related to a Air Pollution Control Act, which is in India. And this is a National Crime Records Bureau, which is documenting all the offenses related to environmental cases. This is which are the agencies one can approach in India: instance of air pollution, state pollution control boards, CB Central Pollution Control Boards, district courts, and National Green Tribunal, High Court and Supreme Court. This is the National Green Tribunal, which is deals with the environmental issues in India. As far as the jurisdiction is concerned, pollution due to diesel vehicles, directions on burning of waste, directions on construction related to the jurisdiction of Green Tribunal in India. This is my home city. I am living in this Tuticorin, which is in the down south of India, which is most polluted in a city. And recently, one industry which is called Sterlite, 13 people died because the shooting held in Tuticorin. And how we are suffering is the words, there is no words to explain it. And this is how we can safeguard yourself from cities' toxic air. Check the air pollution levels before heading out. Avoid going to the areas with high traffic levels. Avoid trafficking outdoors during high air pollution levels. Don't burn wood or trash. And this is related to, as far as the consumers, I kindly request to go through this slide. Rethink your choices. Refuse single use. Reduce consumption. Reuse everything. Refurbish old stuff. Repair before you replace. Repurpose. Be creative and reinvent. Last option, recycle. So we request all stakeholders to recognize the asthma is one of the major diseases related to lung health and support us to build the movement for asthma survivors. Because asthma is one of the major cause. There are several forums for HIV/AIDS, TB, and we decided to build a movement for asthma patients, lobbying and advocacy from community voice. We are launching the Global Asthma Community Forum at 15th World Conference on Lung Health. And I am happy that Dr. Kevin Mortimer is to be a patron for this Global Asthma Community Forum. And we request your guidance, support. So I myself affected by asthma, there should be a voice from the community. Thank you so much for giving this opportunity to Union and to you all. Nandri Vanakkam.
Thank you very much. So we have some time for questions if anyone would like to ask one. Yes, there's a mic just there if you would like that.
This is more of a comment than a question for Dr. Salvi. Thank you for that wonderful talk. This has not been an encouraging seminar. And I want to mention some more bad news. In warm climates like India and many others, global warming is resulting in huge increases in air conditioning use. And with that, not only more greenhouse gases, that's bad enough, and a potential benefit for getting outdoor pollution inside, but a huge problem if the pollution is generated inside. So with many implications, certainly mass fuels, but also tuberculosis. I would estimate that if you close the windows and turn on an air conditioner, you increase the risk of transmission by 5 times. So I think we will be seeing an epidemiologic effect of the increasing air conditioning uses in India, just as we're trying to eliminate TB in a period of time.
Thank you. Thank you for those comments. I think, yes, I think it's important to create awareness about the impact of air pollution and health. And until recently, we always believed that air pollution was the one that came from motor vehicles and industries. We always thought that they are the sources of air pollution. We have nothing to do with it. It's only more recently that we have started appreciating that you can produce pollution inside your homes as well. And that is really something that we need to start creating awareness about, because you're exposed to more levels of air pollution because of indoor sources than what the outdoor sources can be.
Yeah, I'm Dr. Prakash from Bangalore. I have questions to Mr. Sandeep. So it is very alarming to see the amount of household air pollution due to biomass in kitchen. But I have a doubt. If you see our grandmothers and great-grandmothers, they cooked all their lives using biomass, firewood, and they spent 80% of their time in kitchen with large families. And they lived more than 90, 100 years, no COPD, no cancer, nothing. Is it that something we are missing, that we are adding something else, not just biomass, or the type of wood or biomass we are using? I don't know.
You're right in the sense. The levels of indoor air pollution in different types of kitchens is very different. Some of the old traditions, they have good ventilation, so they have a slot at the roof where pollution from the burning of biomass smoke actually comes out. Some have chimneys, some have good ventilated kitchens, some have exhaust fans, and I believe that by simply improving the ventilation of the kitchen, you can reduce the burden of biomass smoke pollution significantly. I would agree with your point that some of the old people lived for a longer period of time, but if you look at the figures, the life expectancy until 1950s in India was only about 40 years or 50 years. It is only in the last 50 years that our life expectancy has increased. So perhaps these are not classical examples, but these are perhaps exceptional people who have survived through all these exposures to air pollutants.
So just more of a comment than a question. I mean, you're describing the problem very well, but where are the policy responses for that? That's one. I don't see the policy makers, here. I live near Anand Vihar, outside of Delhi, one of the most polluted spots in the world. I have asthma since the age of 6 months. But even though we know the impact of air pollution, we continue to see, for example, at Diwali, the bursting of crackers. The Supreme Court has not done anything about it. And you also have other pollution factors. So where are the policy makers who should be on this dais? The Indian government is sitting outside. You have senior additional secretaries flying in, and yoga and good food will not solve the problem of, cleaning up the problem with air pollution. Number two, I would like to say is that I actually don't like the word asthma survivor. I live with asthma. We live with asthma every day. Our life is about steroidal inhalers. Our life is about carrying, about nebulizers. And if you come to my home, you'll see several people nebulizing themselves because we have several people with asthma in the family. So I don't like this thing about survivors. We don't survive it, we live with it. Number two, I wanted to say this, that the TB Union and the Lung Conference is a very elitist platform. It only brings in very elite people, upper caste people who can speak English. And that's where you're creating these forums of survivors. And if you did a caste audit or a class audit of survivors, you will realize that majority of them do not represent the most marginalized communities. So if, people living with asthma have to mobilize, it has to be at a more localized level. So it cannot be coming to a lung conference where you have to pay 400 euros to get registered. You have to apply and file long applications for a waiver and then find some money to travel and pay 500 rupees for a sandwich. I mean, this is not where you build forums for people affected. You know, I'm sorry, if you set it up, I will object. And I will object very strongly because I work with people who have asthma. I have a family that's affected by asthma. And I refuse to be called a survivor. And I refuse to pay 400 euros for this union. Elitist, upper caste, upper class forum for people who already have a lot of resources to fight the diseases they have. And not with the people who don't have the resources to speak up.
Well, thank you for those comments. You want to comment on that?
Great set of questions already. I don't know if Mr. Sanka might want to comment on why he's using the term asthma survivor. I think those were some fantastic points, and I guess what my request would be to please get in contact with me about how we can feed in your thinking about how to maximize engagement for those that we're not reaching, because you've made many very, very good points there. But Mr. Sanka, what about the point about using the words asthma survivor, which of course resonates with the use of the term TB survivor. But are we not living with asthma, or living normal lives but happen to have asthma? What would be a better term or phrase, do you think?
See, on 29th, we had a survivors meeting here. I have attended that meeting. So TB survivors, I used the word asthma survivor. If it is wrong, maybe the experts like you or Rina maybe correct it and we can correct it. Thank you.
Good. So I think it's a request to get in touch and be part of finding a better solution. So we've got actually four more people at the mics, which is fantastic. So I think let's try and get a question from each, but we might try and make the questions short and the responses short. We'll start with, is it Jessica? I think, yeah.
Jessica Elf, Colorado State University. A follow-up on Madam's policy point. I'm wondering how in air pollution we can take lessons from industry influence and tobacco control as we start to think about policy and interventions.
Oh, God, you answer. Yeah.
No, so I was just wondering here whether we should take a round to make room for everyone. So, but that's not my role. Sorry. It was we can't see you from here, so that's why I look strange with the light on my eyes. But it was from there. The question, right, was about lessons from the tobacco industry to the other areas. I think I will respond a little bit in connection with the questions made about what will be the policies that will take care of the air pollution stuff. And I think many of the policies will have to face some of the interference from some other industries that are responsible for air pollution as well, not only the individual at the household level, but also at the industry and air pollution in the air. I mean, there's a set of policies that will need to be implemented and regulation from that. And I think that's lots of lessons learned from tobacco, particularly the perspective that for policy implementation, you normally face some powerful economic actors that you need to deal with, and you need to think through it in order to be able to move forward. I hope I answered the question. I hope it was that. I wasn't clear. I heard it correctly.
Thank you. So the question at the back there, please.
Thank you. Thank you for excellent talks. My question is, in Canada, where I live, we're starting to see cannabis emerging as a big industry. Cannabis is legal in Canada. And we're seeing the fool me twice kind of thing, where the cannabis industry is funding research at universities. And I'm wondering if you've encountered this and what suggestions you may have. I guess this is a question for Dr. Johns primarily.
Well, that's one of the controversial questions that I'm asked many times back at home, because there's a strong movement for legalization of cannabis. And then I have a couple of things to say around that. One of them, I mean, if you look at the prevalence of the use of legal drugs versus illegal drugs, from an epidemiological perspective, from a public health perspective, the legal drugs are much worse. So I think that's one of the issues that we need to keep in mind. The way that the market functions today, what it means in terms of like intake at the population level of a legal drug, I think that's not a minor thing. And then there's all these conversations about the medicinal use of cannabis. I mean, that could happen in a way that it's not smoking cannabis. I mean, surely there are other means of like using for therapeutic purposes. And in Brazil, particularly the conversations around legalization of cannabis, it's very much about the illegal drug trafficking and what it means, and that there are major issues around that. But I think cannabis is only a very, very small portion of what goes around the illegal drugs traffic, which, that's how you say, trafficking of illegal drugs. So that's only a minor part of it. So it's not really the solution for like the legalizing. So I think there are lots of questions that need to be thoroughly debated. And I think it's good that some countries are legalizing it and we see what happens there to have some experience, because once you have some experience, it's easier like to figure out what could better work for the collective.
Thank you. So a question here, please.
Very much. Thank you for the wonderful presentations. I'm Thamar Al-Helfi from Iraq. My main question will be to Paula. Many of the member states in the region, especially in IMRO region, at least from the place where I belong to, they are reluctant to put the electronic cigarettes as part of their anti-tobacco law. Part of it, of course, it's because there is no clear message about that. I myself, I was shocked yesterday when I heard in one of the presentations that there is an evidence that the electronic cigarettes are less harmful than the usual cigarettes. I'm sure Philip Morris will be very glad to hear that the conference is advocating for this. So the point is, and my message, we are focusing on Philip Morris' agenda that about the tobacco is heated or they are using nicotine and not combusted. But we are not focusing to the member states that the solution that it contains, and on evidence, it contains more carcinogenic substances that are more harmful to the cardiovascular system and others. So the point is, the question to you, do you think we should send a clear message to the member states so that we can advocate for this? Or you should follow on the evidence that the industries are always stepping us ahead, because we need always to provide evidence, especially with the new product that is the non-nicotine tobacco, electronic cigarettes. So, should we have a clear message about that? Thank you very much.
So, and before we move to answer further questions, what I'm going to suggest is if we could take a very, very concise question from you, and then I'm going to suggest that we continue this discussion after this, because I can see we're running out of time and people need to leave. So if we take your question and then we can answer them offline, if that's okay. Sorry.
It's just a suggestion that here there is a lot of talk regarding smoking and tobacco smoking products. In India, there is a large population which consumes smokeless tobacco products. So it's just a suggestion for the people working against tobacco industry that there should also be a movement and action against such activities where there is use and promotion of smokeless tobacco products which are chewed by the people, particularly in northern Indian states. Thank you.
So thank you very much. So with many congratulations again to Katrina for the award of the Union Scientific Prize, with thanks to Paula, Sandeep and Sankar for the excellent talks. We'll close this session. Thank you all very much for coming along.